Hey everyone, and thank you for joining us for this conversation. My name is Noah Harris, and I'm a junior at the college. I'm really excited today to be speaking with the Executive Director of Harvard University Health Services, Dr. Giang Nguyen. Dr. Nguyen has been at the forefront of the university's response to the COVID-19 pandemic since the beginning of the year. And this is a great opportunity to ask him about how things are going so far, what steps we all can take to stay healthy, and what he envisions down the road as the pandemic continues to evolve. Dr. Nguyen, thank you for joining us.
Noah, thank you so much for having me here. I'm really excited to be here with you and to share some of my thoughts on where we are and where we're headed.
Of course. So we'll just jump right in. So I want to ask this question for students on campus, especially. I want to know how they can do a better job balancing the need to socialize and meet people, especially for first years that are on campus for the first time. This is the beginning of their Harvard experience. How can they socialize and meet people while staying safe?
So, I know that we're focusing on the on-campus students, but I think that hopefully what I'm saying here will resonate to all of the students, whether they're living on campus or off campus, because most of what I'll say, I think, it can be applied regardless of where you're currently living. Human beings are social creatures, right? So the multidimensional framework, of personal well-being includes, of course, physical and emotional wellness, but it also includes environmental, financial, vocational, intellectual, spiritual, and relational wellness. And so it's that relational wellness that we need to support despite being in a pandemic. And as we try to support one facet of our well-being, it's really critical that we don't simultaneously jeopardize our other parts of the picture. So by trying to promote our physical well-being, we can't jeopardize our relational wellness and vice versa. So, another huge part of our humanity is that we create community. The pandemic is now forcing us to be creative, right, in finding ways to build community while at the same time protecting each other. And I know the vast majority of our community wants to do the right thing, and they just want to have the knowledge and the tools to do it right. So if I try to think about the basics of how we socialize more safely, I think you can break it down to a number of areas. Number one, wear a mask. Number two, take it outside and spread it out. Number three, keep it small. And number four, don't share stuff. If we start with the first part, wearing a mask, and I think this applies whether you're having a social activity or whether you're just living your life, right? So whenever you are around other people, it's not just about whether you trust someone, it's about respecting your health, their health, and the health of anyone who might come in contact with them outside of this present interaction that you're having right now. So wearing a mask is really important. It protects others in case you're infected, and it can reduce your chance of getting ill. So, I know we're doing a lot of testing, and people still get exposed though, and potentially infected in between tests. So, it's really important to keep ourselves protected. And when I say masking, really it's any kind of face covering. It's not necessarily a procedure mask, right? But it has to cover your mouth and your nose and your chin, and it should have a really good seal all the way around. A bandana just doesn't cut it, right? Because it's got all these gaps everywhere. So that's really important to think that through. And then when you have it, you should wear it correctly. Cover your nose and your mouth. Make sure there's a good seal all the way around, and keep your mask on between sips if you're drinking something, or if you're eating. As soon as you're finished taking your last bite, put that mask on, because I know sometimes if you're sitting around and you're eating, you might keep your mask off once you're done with the meal. Like it's good to remind yourself to put that mask back on. And then I would just say that when it comes to masks, be kind to each other. Masks sometimes slide off your nose, and so don't be upset if someone points it out and says, hey, your mask, you know, kind of, I know that that happens to me sometimes. I just don't feel it sliding down. So, so just be kind to each other with regard to all of this. I know I'm talking a lot. I hope this is okay.
No, you're perfectly fine.
I feel like I have a lot to say about masks, but it is really one of probably the most important thing we can do is make sure that we've got our masks and that we use them. But then beyond that is what I said before, is taking it outside, spreading out. When you're outside, those viral particles dilute more quickly. And so as much as you can, socialize outside. Indoor socializing brings a lot of risk, even with small groups. And so really try to avoid that. If you're going to be inside, like just hang out with your suite mates or one other person and still keep your distance, right? You want to stay 6 feet apart, and even more so if there might be shouting or forceful breathing, like if you're exercising. You're going to blow those respiratory particles out a lot farther probably than 6 feet. And so you want to keep even a greater distance apart, and try to engineer your space. If you're going to be spending time with folks, engineer that space in a way that promotes the social distance, right? The physical distancing. Put those chairs a certain distance apart and then stay seated. Put your yoga mats a certain distance apart if you're going to be exercising with somebody else, right? Those types of things are really valuable. If you're going to be sitting out on the lawn or something, keep those blankets a certain distance apart. And that really helps because we tend to want to drift together. And so if we can engineer it in a way that it doesn't have to be something that you consciously do, that really helps.
Those are great points, and I think they'll be really helpful going forward for our students. That kind of transitions me into my next question, which is kind of speaking to the importance of Crimson Clear, specifically for the students needing to do that on campus for the on-campus community. I know they've been doing it for about 2-3 weeks now, and so now it might be getting to be like kind of a routine, and then maybe wondering, specifically why is this important? Why am I going through this daily attestation every day, keeping up my testing cadence? Can you speak a little bit about that?
Absolutely. So you mentioned two things. One is the Crimson Clear attestation, and then the second is the testing. And both are incredibly important. And our ability to reopen as a university is highly dependent upon that. And I can't emphasize enough how important these things are. Number one, the attestation of you thinking about your symptoms every day, consciously saying, okay, I have symptoms, I don't have symptoms. And then reporting that is partly a state requirement for us to be open, right? The Commonwealth requires that we have a process for everyone who's on campus to be consciously thinking about whether they have symptoms, whether they've had a worrisome exposure, and to then report that back in a way that the university can demonstrate that we're thinking about this. So that's really important. And I know that it's not something that we're used to doing. Hopefully the folks who are living on campus now are getting used to that because it's part of the routine. But I would suggest, put a little Post-it note on your door or something as you're about to leave your room every day to remind yourself that this is the first thing I'm going to do, is I'm going to do this Crimson Clear attestation. I'm going to be consciously thinking about how I'm feeling. And then the next part is the testing. And that's very important. We went through a lot of mathematical modeling and looking at the science behind how to open up a campus. And we found that a high cadence of testing is critical for us to be able to safely open, particularly for the residential community. And so we really need all of the students who are on campus for any particular reason, including living on campus, to be doing that testing as scheduled. So all of our students who are currently living in the residence halls need to be testing 3 times a week. And it is based upon the science of doing the mathematical models. so that we can prevent a serious outbreak from happening in our community.
Right. Can't over explain the importance of the testing and the Crimson Clear especially. Another question I have is, what if a student feels sick between tests, in that in-between period? What should they do, and how should they engage with HUHS?
So HUHS is, for those of you who are new to Harvard, HUHS is Harvard University Health Services. It is the health center for all of our students. And by the way, we also take care of thousands of faculty and staff and even retirees who are part of our community. But with regard to our students, you have access to Harvard University Health Services if you're ever feeling ill, because that's part of what you're paying for being here. Okay, so if you need a clinical visit, you are able to access that without having to pay a copay. For those of you who know what a copay is, you don't have to pay a copay if you're coming in to get those services at HUHS. And so I encourage you to take advantage of it. But one really important piece of how we're approaching medical care now as a result of the pandemic is that our clinical assessments start off with a telemedicine encounter. So I want to make sure that everyone knows that if you're feeling sick, start off by reaching out to HUHS so we can arrange a telemedicine visit, because many things can be handled with us taking a look at our patients through Zoom, but we use a HIPAA compliant version of Zoom. And then we can decide, okay, do we need to bring you in for a test? Do we need to bring you in so we can take a listen to your lungs? But what that means is you don't have to spend as much time physically in the doctor's office. And that's good during a pandemic, because you don't want to be spending a lot of time hanging out anywhere where there's other sick people, right? So we do the majority of our care remotely first, and then we might say, you know what, I've seen enough through Zoom, and the next step is I need you to come in for a blood test. I need you to come in for us to do an extra swab to check you for something like COVID. Or I do actually need you to come in because I have to press on your appendix. But what that means is you don't have to spend a really long time with the doctor in the room sharing the air of that room. You come in and we know exactly what we need to do. So start with telemedicine and then go from there. Don't just walk in, because I think that will really streamline the care that you need. But again, any student, and if you are a matriculated student here, whether you're living on campus or off campus, you have access to HUHS. And if you're worried that you have symptoms of COVID-19, reach out to us and we'll check you out.
Right, and thank you for that. And as a student living off campus in Boston, that's really helpful for me to know as well. So going forward, and this is definitely for everyone off campus or on, what if we know someone who tests positive for the virus? What specific actions should we take?
That's a really great question. I think that over time, many of us will come across the news that a friend, an acquaintance, a family member has tested positive. And with that news often comes a lot of questions, uncertainties, anxieties about what does that mean for me? The most important piece of it is to seek advice on what to do next, because the future actions will, of course, have implications for your own health, but they also will have implications for the health of the people around you, the people that you care about. So seek advice about that. Not everyone who has been in touch with a person who tests positive necessarily has to go into quarantine, but that really involves a level of back and forth and understanding so that someone who's clinically knowledgeable can give you that advice. So if you find out, you want to kind of separate yourself from other people until you've talked to someone at HUHS and then we can tell you what happens next. And I also do want to remind folks that if we tell you that you need to quarantine, it's not like a punishment. I know it often feels that way, but being asked to quarantine is part of our response to what's happening in our community, and it is a way of keeping our community safe. It is not a punishment for having had lunch with somebody or having had a social interaction. This is really something that we all need to do, and certainly it's disappointing when you're told you have to curtail your activities for a while, but it's really for the greater good, and that's really that's important to keep in mind as we're going through it. And if you are in quarantine, do try to keep your social connections. Reach out to people, FaceTime with other folks. Maintain those connections. And if you have a friend who's in quarantine, reach out to them, check on them, see how they're doing through electronic means. I think that means a lot to folks who are feeling isolated.
Oh, that's great advice. Especially during this time, it's just so important to take that extra effort to reach out and check on people, regardless of where they are, what they're doing, for sure. I also kind of want to know what has worked well so far this semester, and what will you consider changing as we move forward, going forward into the spring semester?
I think what has worked really well is the testing program, and I'm so grateful for all of the partners across the entire university who have really helped us ramp up this program. We have, at this point, processed 55,000 tests since June, and that's a lot of tests to process through. And we started doing this back when the laboratories began to reopen, and we learned from that process. And then as we started preparing for students from the college to move back in to the residence halls, we built on the experience of earlier in the summer, and then we're able to expand it further. Now that we're able to test our students in a more distributed fashion, where the students are able to swab themselves in the privacy of their own dorm rooms, and then be able to drop off those specimens, it really makes it more convenient for the students, and hopefully that ensures that people are going to do it on time and at a regular cadence. As I mentioned before, it's so important to do that. So I really feel that the testing has been a really important component, and I'm really glad that it's been successful. And as we think forward to the future, one of my biggest concerns is that we become complacent. Right now we're feeling very good about how things are going, and the test positivity rates have been very low across Harvard and across many of our peers in other colleges in the region. But it could turn on a dime if we're not careful. And so we very much rely on everyone in our community to stay on top of all the things we've mentioned before, and to not think that just because the numbers are going down, it means that we stop following the advice of the public health professionals out there. It's really, that's what's keeping us safe.
Right. Well, that brings me to my last question. There's been so much talk about the potential for vaccine, and there seems to be wildly divergent views on when to expect one and what that rollout's going to look like, and then how effective it will be inevitably. And so I'm not asking you specifically to pull out a crystal ball and try and predict specifically what's going to happen, but I'm just wondering, what are your expectations on this front?
Vaccines have been such an important part of the public health response for so many infections across history. And I think that there's great promise in what we can do for COVID-19. It's very hard to say exactly how long it'll take or when it'll be available, but there are two components to this. One is, how far along are the studies and how good is the science in terms of identifying something that really works? And the next part of it is, once we know that something works, are we able to scale up at a level that really permits vaccination of a huge number and a high percentage of our population? So both of those things are very important as we think about moving forward. One thing that's really extraordinary about the current times that we live in is that things can move a lot faster than we normally would expect. And that's because so many resources are being thrown at it. So when you see all of these pharmaceutical companies and independent laboratories and academic institutions all trying to work on this, you are able to move things forward much faster because rather than, say, having a company that says we're going to devote 100 people to working on this, if they say we're going to have 400 people simultaneously working on it, the science is absolutely going to move faster. And so I know there's a lot of conversation about like, oh, it's Operation Warp Speed. They're going to be cutting corners. They're going to be doing all sorts of things. Certainly we want to watch for that, but we also have to understand that so many more resources are going to it that we would absolutely expect that the science will move forward faster.
Yeah, well, thank you so much for answering all of my questions. I want to thank you, Dr. Nguyen, for all the amazing work that you're doing with HUHS to help keep us students safe, and all the guidelines and all the advice. We thank you for that. I hope that all of the students listening, that you are listening, that you take Dr. Nguyen's advice, so that we can keep our community safe and come together, so we can beat this and we can all get back on campus safely.
Terrific. Thank you so much, Noah. I really enjoyed chatting with you about this, and I would just leave by reminding everyone to mask up, keep your distance, wash your hands.
Right, and thank you for joining us, and that ends our interview.